95.5, 88.3 FM, ZJB Radio.
Good afternoon to governmental officials, members of the press, viewers, and listeners, and welcome to today's press conference to discuss the COVID-19 situation on Montserrat. As you know, we have seen an increase in cases over the past few days. The Premier, Honorable Joseph E. Farrell, Minister of Health, Honorable Charles Kernan, and the Chief Medical Officer, Dr. Shara Greenaway-Dubry, will provide an update on the latest developments as it relates to COVID-19. Following this, members of the press will have an opportunity to ask questions, and they are connected virtually. Premier, over to you. Good afternoon.
Thank you, Fiona. Good afternoon, viewers and listeners. Let me first of all take this opportunity to wish all of you again a very happy Christmas, happy New Year, and I'm hoping that what is transpiring now is no indication of what we will go through for the rest of the year. It's our hope that we'll have a good 2020, free of course, COVID to a certain extent. As Fiona has pointed out to you, over the past couple of days, we have been monitoring, the Ministry of Health has been monitoring the situation as it relates to growing numbers of positive cases of COVID-19 on Ireland. We have been receiving regular updates from the Ministry of Health. And as a result of that, Cabinet met yesterday afternoon due to the increased numbers to get advice to get updates from the Ministry of Health and to see what needs to be done, if anything at all, to try and curtail the spread. We recognize that the health team needed some time to be able to conclude their contact tracing. Because what seemed to be transpiring is that the width of the tracing seemed to be much wider than I personally thought, and maybe some of us. And so we met, and having listened to the professionals from the health ministry, we decided to take a couple of actions to give them enough time, at least another week, for them to go through all the contact tracing and determine how fast spread this thing is and whether the numbers are increasing. I will not go into any technical detail. I will come back to you in terms of the actions that we took. But before that, let me let the Minister of Health come in, and then CMO will update the public on what is happening at this point in time. Thank you.
Good afternoon, listeners, and I wish you a happy New Year. Today being Sunday, the 2nd of January, first Sunday of the year, most churches would have been having renewal of their commitments and their vows to the Lord. And so it may be timely that with this situation that have arose, that we have to now look at the rules and the regulations we have in place and have a fresh commitment to them if we are going to continue to curtail the spread of the virus. As was said before, it was a Friday, I think we had moved down to 1 case by midday. Then by afternoon, we were back up by 1, 2. And then by Saturday night, between 7 and 8, we were up to 6. And the numbers are still growing. So that's where we are. And we note that the enforcement of the SRNO, the rules, have been a bit lacking, and people have become a bit complacent, seeing that we were down to 1. In fact, for a few weeks, we had none. And so at this time, as I said earlier, we have to look at making a commitment as a country now, as the church members would have been doing today, to follow the rules, to protect ourselves. Because, as I've said from this place before, we are going to err on the side of caution. And the health and well-being of our people is of paramount importance to us as a government and as a ministry. And therefore, I am saying now, as we go through this conference, I hope that the questions would be centered around this very pandemic and the situation we find ourselves in. And I'm sure that there'll be suggestions possibly that can assist us. And so now I'll ask the CMO just to give us a little update at the situation at present.
Good afternoon, everyone, and Happy New Year. The situation is this. As of 12 noon today, we have 8 active cases. So I'm going to repeat, as of 12 noon today, January 2nd, we have 8 active cases. And so for the purposes of this discussion, I'm going to go through the cases, and we're going through case 1 to 8. So the first 2, as Minister would have mentioned, those were imported cases. So persons that would have traveled into Montserrat and tested to be released from quarantine and were found to be positive. However, case number 3 is our first community-acquired COVID-19 case, and I'm going to explain what that means. So basically, this person did not travel. This person was not in quarantine, because we have some persons that are living in Montserrat. They have visitors that come, they're visiting them, and they go into quarantine with them. This is not the case. I'm going to repeat this. This is not the case. So this person has been living in Montserrat, working, moving around in the community, and they somehow contracted COVID-19. Now, we are unable to establish how that person contracted the virus, and so that is why we are labeling it as community acquired. So once that case was identified, we began the contact tracing process. We identified 13 close contacts, and this is a combination of household and other personal contacts, including workplace contacts. And out of the 13, we found an additional 3 positive cases. And so that is how we got to 6 active cases as of yesterday. So in doing additional testing, because once the news got out that we had all of these cases and that one was community acquired, we now had 2 persons who were displaying symptoms or reporting symptoms. Those 2 individuals were tested and they were found to be positive. So I'm going to say here now that these 2 additional cases have no link to case number 3. And so they have also been classified at the moment as community acquired. So this is just to say that we probably have community transmission. And so a lot of the things that Minister would have alluded to earlier in terms of enforcing all of the public health measures that we had established before, we really need to get serious about this. So just to give you an idea of the number of persons that we would have tested yesterday, so we tested a total of 46 persons yesterday. And so that would have revealed the additional cases that I spoke about. So far, the contact tracing that occurred between last night and as of 12 noon today, we have identified an additional 31 persons. And so those persons are in the process of being sampled, and they will be tested later today. And so we are expecting the number of cases to increase, and I'll tell you why. Because a few of the contacts are reporting flu-like symptoms. So we are fully expecting the case numbers to increase. We can't say at this time what numbers we are expecting, but just to let the public know that we are probably going to go beyond 8 cases by this evening. In addition to the other measures that the government of Montserrat will put in place, I would just like to petition to the residents out there. If you are experiencing flu-like symptoms, it could be as simple as an itchy throat, you just have a runny nose, or you have nasal congestion. Please, please, please stay at home. Do not go to work. Don't go to another family member's house. Don't go to any gatherings or anything like that. Please stay home. Please give us a call. There are 2 numbers that you can call. Their cell numbers, 496-7437 and 493-4755. There was an infographic that was developed last night that should be circulating among social media and other media houses. But I'll just repeat the numbers again, 496-7437 and 493-4755. If you have symptoms, if it's just as mild as an itchy throat, or you don't feel yourself, or you have a mild fever, or anything like that, please give us a call. Please stay at home. Please do not visit the casualty department and do not go to any health centers at this point in time. Give us a call and we will advise how we will conduct the test. We will either visit you or we will tell you to go somewhere, but please stay at home. That is the end of my update at the moment.
Okay, thank you very much. Now that we have heard, they have had the introduction, I guess the press, the members of the press will be interested in knowing exactly how and why we arrived at our decisions. You heard Dr. Greenaway's outlining the process and the situation as it is unfolding, and it continues to unfold because another 31 persons to be tested would mean that we may have additional cases, and there might be more because, as Dr. Greenaway would tell you, every time she finds a positive case, then she has to now go and contact trace those persons again. So it's an ongoing situation where every positive case has to now be contact traced to make sure, and every time you find additional persons, so the numbers are growing. And last night we took some actions, but let me set your heart at ease. Locking down of this country is not an option. Let me put your heart at ease, because there's no way that this government is going to take lockdown of this country. Our children are suffering. As a matter of fact, children are saying to me, please. And when I heard a child say to me, Premier, please don't lock down the country, I become concerned because mentally, physically, psychologically, our children are suffering with lockdown. So we can't. That's for number one. Yes, we will have to do some interim measures. And so what we have done, the press release came out last night. Many of you would have seen it. And what we have done to give the Ministry of Health some time to complete their contact tracing and identify everyone who came into contact with other persons was we suspend all other activities for the rest of the season, at least for 1 week. So the King of Kings and whatever it is, there are persons who had their beach fetes and some other parties, and we actually asked that those be suspended because we want to reduce that close contacts again. We actually reduced the number of persons of large gatherings to 15. And let me again say, this is basically for a week in the first instance to allow the health team to get through their work and to reduce the number of contacts. So these are basically what we did. We suspended all those activities for Christmas, whether private or public. We actually asked you to, as Dr. Master just said, stay at home. We reduced the numbers to 15. And please, the major problem we are encountering is that persons have now refused or become complacent and are not wearing their mask. Mask and taking the necessary precautions to avoid your exposure is absolutely critical. And let me make it abundantly clear. I will be speaking to the governor and the police. The police, as of tomorrow, will have to enforce mask wearing. There's no if or but about it. We are becoming very tired of persons not adhering to the mask mandate. And this is going to expose you to other persons and to the risk of contracting the virus. Whether you are sitting at a bar, I noticed personally, I've noticed persons going into supermarkets, and the supermarket owners are not saying anything. They're accepting their clients without mask. This cannot continue. And if I sound a little harsh, that is how I really feel, that at this point in time, mask wearing is actually critical for all of us to make sure that we reduce the number of cases. So those are the actions we took. School, of course, fortunately would not have been open until the 10th, but I know the minister also included, the Ministry of Order said that nursery schools and daycares, which was due to open this week, is also suspended until until further notice. So there will be no daycare, and I know that some of you, are working mothers, and you probably ask, well, how can you take care of your babies? I'm sure that your employers would at least compromise and give you some latitude in terms of how you manage to look after your babies for another week. So I'm very sorry, but that is the situation. So all schools are closed, or will continue to be closed until roughly another week or so, and then after that you get an update. So these are the updates that we have to bring to you, and I now turn back to Fiona.
Just before, you need to include the MONTSERRAT Community College is also included in the schools.
Yes, thank you. Yeah.
And while we're at it, the hospital visiting will be suspended except for next of kin and the old people's home as well.
And of course, vaccines are available. Can I help push that one in?
So thank you all for the updates. We'll now turn over to members of the press for questions. And members of the press, you are connected virtually, of course, with the exception of Radio Montserrat. The questions, 2 questions per media house, and we'll start with Radio Montserrat.
Thank you very much, Fiona, and good afternoon to the panel. It's now a matter of being able to coexist with COVID-19. Now, I'm aware that a number of proposals were made to the government in the fall last year to actively monitor quarantine with bracelets, etc., other mechanisms. From what I'm gathering, all of our issues have emanated from a person or persons breaking quarantine. Now, why has the government not acted on these proposals to establish a mechanism to help to increase the monitoring of quarantine, persons in quarantine? And the Honorable Premier, the Minister, you can both chip in and answer that question.
Thank you, Mr. White, for that very important question. There is actually no evidence that persons in quarantine have in fact violated their quarantine rules. And we know that there are different means by which the virus can spread. And over the past 2 years or so, what we have noticed is not that people who are inside are coming out, but the other way around. Persons from outside are going in. And while there is no evidence that anyone break their quarantine at this particular time, and while also there's no evidence that it is somebody who went in, either of those scenarios have placed us in this position. And the most likely situation is that somebody would have gone to a house where somebody was under quarantine measures. And that's just, there's no official thing, but that's my personal view, and don't take it as is. So that's where we are. So yes, we might conclude that person may have violated. And that was my fear at the beginning of the season, but that seemed not to be the case at all times, or most of the times. In relation to the bracelets, we have in fact imported some bracelets, and I was determined that we should have those bracelets ready for this festive season and for March. We had some technical ditches with it, and I personally intervened, and where we are right now, I think the service providers have already connected about 50 of those bracelets. They're now back on system because the bracelets as they are having a GPS chip, which allows you to detect where persons are, and sort of thing. And there was some technical problem with those. I think as of last week, we had about 50 that were ready to go. So I can assure you that by mid this month or end of this month, we should have those bracelets ready and up so that we can use those to detect. But that in itself is not going to prevent the spread of COVID. And yes, you speak to coexisting, and we have to. And that is why I'm saying to you, Lockdown is not an issue right now. We have to find ways and means of us protecting one another, wearing our mask, sanitization, and reporting our feelings to the health professionals so that we can live with COVID and still go about doing our daily task. I hope I answer your questions.
Yes, you would have answered to a certain level, because whether someone breaches quarantine or someone goes in, the end result would be the same. Now, the next question that I have is what are the procedures now that we know that we are exposed in order to curtail the spread of the virus? What are the measures that we are now putting in place to ensure that we curtail that spread?
Let me start by saying that the measures in place have been in place from the very onset of COVID. And as cases came and started growing, those measures have increased, including fines in the SRO, the mask wearing, the hand sanitizing, the contact tracing, the flu clinics. Everything has been in place. When we went down to one, then you didn't need the flu clinic. Now we might have to look at that flu clinic again to ensure that those who have these symptoms, in fact, will be dealt with. There's not many things that one can put in place because we are dealing with human beings. And we can write laws and regulations until kingdom come. You will find that if all the laws that were written in the world were implemented, what a wonderful place the world would have been. But they're just on the books. Now, when you spoke about the bracelets, true that the ones that we had some technical, one, they weren't going online. Then there still now need to be checking and ensure that the GPS part of it is functioning, or else it really doesn't make a lot of sense. And what we want to tell the public, so if somebody came and brought a little package for you, for 5 days you could wait. You don't need to go and pick it up. Things like that has been happening. People have gone on the verandas and drinking. People call and say that. But when you ask, will you be willing to give evidence that this person has been doing that? No, don't call my name. It is evidence that wins cases. So with the best will in the world, unless we are getting the cooperation of the public, and since these numbers have increased, people have been saying all about the people in quarantine and who's been out and who's been visiting. But will they be willing to come forward and say it in the court of law? Unless that happens, we have to be our brother's keeper if we intend to curtail this pandemic. And so I'm appealing that if you see others you know should be out, the bracelet will tell you the person that is in quarantine. What the bracelet wouldn't tell you, who visited. And so the measures that we have in the SRNOs, once they are implemented and enforced, I believe they will help in the curtailing of this pandemic as we go forward. And
so just to echo the sentiments of the minister, once persons follow the protocol in terms of the Ministry of Health, we are actively contact tracing. So once we identify a positive case, we're working with the individuals because they themselves have to cooperate with us in terms of identifying their close contacts, work contacts, etc., and remembering all of the places that they would have been in the last how many hours or days. And then we systematically go through and we test all of those individuals. So in addition to that, yes, we had discussions about establishing the flu clinic again. What we're working on is the staff complement and the location. So it's just a matter of making that decision. Once that is sorted out, we will communicate that to the public. But in the meantime, if you are experiencing symptoms, I'll repeat the numbers again. 496-7437, 493-4755. And so in addition to that, I just want to put a plug here that part of the fight against COVID-19 is vaccination. We will be continuing our vaccination program as per schedule. If you have not yet registered, please call the St. John's Clinic on 491-5218 and register yourself to receive either your first dose if you haven't been vaccinated yet, and if you've received both doses, to get your booster once you are eligible. And that would be 3 months after your second dose. Please remember that we have Pfizer available now, so age groups that are now eligible from the age of 12 upwards, you can be vaccinated. So parents, please take that into consideration. Also, pregnant women, you can also be vaccinated now that we have Pfizer. So please register.
And Pfizer is also for persons who do not want to take AstraZeneca. But prefer
Yes, so
Pfizer.
we have options now. So.
Right.
Okay, so we'll continue with questions from the press, and we have Mr. Roach online from the MONTSERRAT Reporter. Mr. Roach.
Thank you very much. It never ceases to amaze me why we continue to promote the vaccine, which is fine, because IBENET is not against anybody having vaccine. But some of the people who you tested, who came in and were tested, were people who were vaccinated. So the possibility of being infected and transmitting exists. Now, my good dear doctor mentioned about if it's a simple thing as an itchy throat. This also amazes me that we do not tell anybody what to do other than to stay at home if they have a simple itchy throat. And there are simple things, measures that they can take right there and then, which if they take there and then, goodbye to whatever. And that's what I've mentioned in the last time I was on here in the press conference, that we should be talking to people about what treatments they can take when they have that little thing, or even before, how people must continue from day one. We should be talking to people about how we can protect ourselves along with all the protocols that have been mentioned. But no time have I heard anybody tell anybody. It's all out there. The information is out there as to what they can do to prevent themselves becoming infected. And if they do get infected, to be aware of it early and take some action. My goodness, please stop telling people just stay home and do nothing until when the symptoms become perhaps too strong for them to call. People are not going to call the hospital ever if they have an itchy throat, or call any number if they have an itchy throat, because there are some of those who are not even hearing this. Now, question, those people who we've been contacting, etc., the people who are coming, has that contact shown us anything that will relate to the fact that they were at the concerts, the indoor concerts that have been taking place?
Oh, I'm sorry, Mr. Roach. I wasn't aware that your question had ended. So I would like to address both things. So the statement that you made before your question. So I did not indicate that persons should not do anything if they just have an itchy throat. So as mild as your symptoms are, and this is part of the promotion that we're doing as the Ministry of Health, you are to report it to the Ministry of Health so that we can get you tested. But that's not the only thing that we do. So we have doctors and we have the quarantine management team. We have nurses as part of our team. We also do wellness checks for these individuals, and we give them medication, etc., if that is required. Now, in terms of the home remedies and so on that you can do, persons are well aware of what they do for an itchy throat because it's just like the regular flu. So if you want to use your lime and honey, that is fine. If you want to take paracetamol for your fever, that is also fine. If you want to take vitamin C and zinc, all of those things are well and good. What we do not want is for people to institute these home remedies and not inform the Ministry of Health that they're having symptoms and then perpetuate the problem. So what we are trying to do is to make sure that people are aware that the symptoms can be as mild as an itchy throat or just nasal congestion, which is all well and good because we don't want people to have severe illness. Never did I say that persons must wait until they have severe illness to contact the Ministry of Health. I did say it could be as mild as an itchy throat, or even if you don't feel like your normal self, you are to contact us and give us the numbers. We also give people advice on what to do if they're not feeling well, etc. So please appreciate that. And in terms of your second question, we are now at the level of community transmission. So we are unable to say whether it was indoor activities, etc. These people would have been going about their usual business, going to work, shopping, and so on. So it's very hard to say whether they contracted the virus at an event, or if it was at the supermarket, or if it was at their place of work. So that we cannot comment on, or we can't determine that based on the contact tracing process. We can, if we go deep enough, and we will try to do that, establish a link between a known positive case and one of the community acquired cases, but we may, and the reality is this, we may never be able to do that. And I want the public to understand that. And it's not unique to Montserrat, it has happened to a lot of countries overseas. Thank you.
I will defer to Mr. Castle.
Mr. Roach, it's just 2 questions per media house, and Montserrat reporter. Was it 2 questions you just asked?
I'm sorry. This 2-question business cannot be. Listen. Get.
Okay, so we'll move on to the other question.
Thank you very much. Has any thought been given to St. Patrick's Day celebrations coming up in March of 2022, and whether or not there's consideration being given to canceling the St. Patrick's Day celebration, given the recent international trends in terms of concerns for this new variant?
Thank you, Mr. Castle, and welcome home, may I say. I hope you're home. There's no thought to cancelling St. Patrick's. As a matter of fact, my advice to my colleagues is that we must find ways and means of allowing persons to ease the pressure, the psychological and mental pressure of COVID that exists over the past 2 years. And I think that when I announced that we were going to have St. Patrick's Christmas festival, it was in that vein. And I still maintain that we need to give people some time for them to shake off the burdens of COVID and free themselves mentally and physically. And so no thought has been given to cancelling St. Patrick's. What will happen? And as of now, I will start speaking to my colleagues, and for us to determine what measures can be put in place to facilitate St. Patrick's while at the same time protecting the health of the people. So there is no thought of cancelling St. Patrick's, but we may have to take other measures from now on to ensure that we can have some celebration in an environment free of COVID. And that's as we are right now.
Okay, thank you very much, Mr. Castle, as part of the Montserrat Reporter team. And those are the 2 questions for the Montserrat Reporter. We'll move on now to 664 Connects.
Question.
664 Connects with
hello. Beyond, I'm not finished.
Bass.
I said I have a supplemental question, as simple as.
Mr. Castle, sorry, I could not hear you because based on the connection that we have here with the system, I wouldn't be able to hear you unless the mic was turned on the system's end, which they just did. So I'm now able to hear that you have a supplementary.
Thank you very much.
You're welcome.
Very much. My question is regarding the issue of residents and citizens of Montserrat not being able to travel abroad via Antigua unless they're vaccinated. Is there an update as to whether or not any effort has been made to address this particular issue? There are persons on Montserrat or wishing to return to the UK, to the US, Canada, or elsewhere. And even though they're not staying in Antigua, they're just in transit, as you know, they're prevented by virtue of a policy issued in Antigua. My question is, has any diplomatic efforts been made lately to see whether or not this will continue, or if it can, some arrangement can be made where there's a quarantine area within the airport for those who are traveling to or from Montserrat via Antigua, so as to whether or not they are vaccinated or not, so they can pass through?
Thank you very much. A very, very interesting question, which has been asked several times. The position of the government of Montserrat is that persons, unless their condition prohibits them from doing so, is to get vaccinated. That is a government of Montserrat's position. We have arranged with the Antigua government, in cases where persons cannot be vaccinated for health reasons, that they be allowed free access, and that has happened on several occasions. There are several Montserratians who, because of their medical conditions, receive their doctors' recommendation from doctors and were able to pass through Antigua to go beyond for other treatments. Also, there's a protocol in place with the Ministry of Health for persons who have to go to Antigua for medical treatment recommended by the ministry to get access to Antigua through that standing protocol. If you're asking me, as Premier of Montserrat, if I am going to negotiate with the Antigua government to allow all Montserratians who are not vaccinated to pass through Antigua, I'm going to tell you the answer is no. I have not had that discussion, and neither do I intend to have that discussion. Our policy here is clear. We are encouraging Montserratians to get vaccinated. That is the only how we're going to ease the pressure off the people who are living in Montserrat. That is the only how we're going to be able to fight COVID. That's the only how we're going to be able to open up our borders so that our economy can start growing. If we continue to compromise this situation, we will remain locked down indefinitely. And as your premier of this country, I cannot promise anyone that I can keep this country locked down indefinitely. There are persons in this country who have not worked for 2 years, have not done a living because the tourism sector is locked down. And we do everything as a government to shield the people of Montserrat. And we give the opportunity to become vaccinated, to help us, to help those persons who need to make a living. But because the tourism sector is shut down, because people cannot come in, they're just barely surviving. And the pressure really now is on the social services system to maintain them. So the question, back to your question, if you're asking me if I'm negotiating with the government of Antigua to allow free access for persons who are not vaccinated to go through and from Montserrat, the answer is simply no.
Okay, moving on to the 664 Connect. Bernie Abbas, good afternoon. Your 2 questions, please. All right, we're not getting audio from Bernie Abbas, so we'll move on to DS Media.
Hello, can you hear me?
Okay,
Can you
yes.
hear me? Can you hear me? Hello?
Yes, we can hear you now. We can hear you now.
Okay, so Beneba 664 Connect Media, thank you very much for having me, and Happy New Year to everybody listening. So my first question is, what variant of the COVID vaccine are we dealing with? Because that hasn't been mentioned throughout this conference. And how many of those persons were vaccinated or took the booster who are currently in quarantine?
We didn't get the last part. We didn't get the last part of it.
I said, what variant of the COVID-19 vaccine are we dealing with in these persons who have tested positive? And how many of those persons were vaccinated or took the booster?
Okay, so I think you mean the variant of the COVID-19 virus and not the vaccine. So we are not aware of what variant it is. The samples have to be sent to CAFA in Trinidad to be genomic sequence. That's what we call that aspect of the testing. So they have to be submitted for genomic sequencing. That's when they actually break down the genes of the virus, so then we can determine what the variant is. So at the moment, we don't know which variant we're dealing with. In terms of the breakdown in vaccination for the 8 individuals, 4 of them are vaccinated, fully vaccinated, and the other 4 are unvaccinated. I don't think any one of them have received the booster as yet.
Okay. When you went through how the 8 persons acquired the virus, you mentioned that there are 46 people or 45 people who are currently being tested, but only mentioned that 15 are in quarantine. How come the persons who have been tested are not in quarantine to limit the community spread?
So the 15 that you are referring to is as of 12 noon yesterday. So that would have been a combination of travelers and a few persons for quarantine. So we have to go back to the definition of quarantine and isolation. So persons who are positive, they enter into isolation. So we don't report on the isolation numbers for obvious reasons. And then, of course, you would have a few persons who would enter into quarantine. So yes, we had a large number of persons being tested yesterday, the total being 46. As part of the contact tracing process, so what you do is a wide net. So I mentioned that you would have identified household contacts or the personal contacts. When we talk about personal contacts, we talk about like friends, other family members that you hang out with a lot, right? And then you do workplace contacts if the person was symptomatic or they would have been at work a few days before they became symptomatic. So you do that wide net first, and then you do a risk stratification to then determine who are really the close contacts of this individual. So once you're wide net, most of the wide net people out of the 46 would have tested negative. But when you do further questioning, you realize, okay, but this person hardly comes into contact with this person, even though they work in the same place. Their offices are very far apart. They don't sit and have lunch together. They're not even friends. They don't speak. So that sort of thing. And so you then narrow down the numbers in terms of the numbers in quarantine. So that is why you have that discrepancy between the number of people tested and the number of people in quarantine. So the actual number of people in quarantine would be a lot smaller once you go through your wide net and you do your risk stratification. I hope that answers your question.
How many people are in quarantine now if it's not 15?
So as of 12 noon today, we had 25 persons in quarantine.
Okay, thank you very much. 664 Connects. We'll move on now to DS Media. Dwight Sampson, good afternoon.
Hi, good afternoon, Fiona. Good afternoon, listeners. Good afternoon, Premier.
Good afternoon, sir.
And your panel. Mr. Premier, Mr. Health Minister, Madam CMO, piggybacking on James' question, there have been numerous calls last year for the enlisting of the Defense Force in assistance with the RMPS to do regular island-wide patrols, especially in areas where persons are said to be quarantined. And I would think that the Ministry of Health would have that information. Why has that not been done? I know that the minister sometime earlier would have said that the ankle bracelets would tell you the persons who are in quarantine, but wouldn't tell you the persons who are going in and breaking the quarantine. Don't you think that island-wide patrols with the Defense Force and assisting the RMPS will be able to curtail that? Question one.
Thank you very much. Cover question two afterward. Yeah, let's do the question one. The last thing that the Ministry of Health wants to do is to appear to be bullying persons who are, or intimidate persons who are in quarantine, who are in isolation or quarantine.
And quarantine.
The last thing they want to do is to intimidate persons. You want people to enjoy quarantine, so that when we ask you to stay inside, that you don't feel bullied or being watched to a certain extent. We have, in fact, as a matter of fact, one of the suggestions we made earlier in the season was to embody the Royal Montserrat Defence Force, and that has happened. If you look around, you note that there are defence force on the streets and establishments. We don't place individuals at somebody's home, because you expect people to behave as human, as mature people. And, you know, just to put a police outside of your gate, I will feel intimidated, to be honest. And so I don't know that is the best thing to do. If it reaches a stage where there are individuals who persistently break their quarantine period, then clearly you have justification in putting a police officer next to their door. But I don't know that that had happened, and I don't intend to support that kind of intrusion on personal life unless there's clear evidence that they're not complying. So the Defence Force is out there to help us to ensure that establishments maintain the mask wearing and the sort of thing, sanitization. And that's as far as we are right now. But I don't know that we have reached a stage where we want to put an officer outside of somebody's gate to watch them. It might come down to that eventually, but at the moment, no.
Premier, I had to take a look down to just make sure that what I was saying was actually accurate. No one is saying to put officers. I don't even know if we had the manpower to do that outside of people's doors. My question was for patrolling of areas in Montserrat, just to ensure that persons who are on quarantine remain in quarantine, that persons do not go into a quarantine area. But No,
okay, yeah, I hear you. And what I've done, and I've asked the Ministry of Agriculture, because persons in quarantine are spread far and wide, and same with advise me otherwise. You know that you have people in Lookout, and I'm not saying that where they are now. I'm just giving an example that you might have people in Lookout, in Mungo Hill, in Bazis, in Cotterhead, in Banks, Salem, wherever. So the net could be wide where persons are staying in quarantine. What I'm working with now with the Ministry of Agriculture is to see how best we can do a GPS mapping system and have that in place where, not giving names, but rather saying to the police, there's somebody in quarantine at these points. Could you make some regular checks along the road? Because I agree with you, just the presence of a police in an area where somebody is in quarantine, not necessarily at the door, could deter breaches if there are any. So I take your point.
All right, Premier. And just to also add, no one was saying about bullying or person should be bullied, but this is the second time that this has happened where persons are suggested to have happened where persons should be in quarantine and somehow, because we have community spread and no one can tell us how this has happened. Moving right along, my next question is to the Minister of Health, and good to see you, Honourable Minister. Happy New Year to you. It's good to see you on a panel for a press conference. You have said last year in one of your radio updates that there was to be the establishment of a quarantine facility somewhere in Braids. So far, we have not heard anything of that. We haven't seen the opening of, I can speak for DS Media, we have not heard or seen the opening of that quarantine facility. Is that something that will be looked at again in the wake of this second wave of increasing COVID-19 cases on Montserrat?
I have no knowledge of us planning to open a quarantine facility. And I believe the last time I was here, that question was asked and I said the same answer. We never had, the only time we spoke of, we had different facilities that we have asked the persons to register for. And therefore, if we come down to that, we would have been able to have quarantine facilities, but not a particular one that we're going to create in Braids or any place else. I think we looked at, we had a number of people registered, and in the interim, we used to have people ready. When they come in, they go to those facilities if they didn't have places to go. But remember that itself, in the countries where you have these facilities, take Anguilla for instance, where they had a facility, but they closed it eventually because it became a burden financial burden on the government. And I do not think that Montserrat is in a position to open such facility and then charge people these enormous sums and expect that the government will be paying half of it. So there's no such facility. I think there is record where you can, if you don't have a place to stay, that they can in fact check into some of these places still.
Yes, there are about 5 facilities, and it's listed on the Government of Montserrat website, the names of the places. I don't know if you're referring to the isolation facility, because that would be different. That is located at the hospital, bottom floor of the Magotson Memorial Home. We would have converted that into the isolation facility to house potential COVID-19 severe cases.
And prior to that, we had the old physiotherapy.
The physiotherapy unit.
Which we had converted into isolation prior to, in the height of COVID.
But at the same time, too, if you are staying in any one of these so-called quarantine facilities, it's up to you and the proprietor to agree on your prices and other things. That's not a government expense. That's really at your expense. So I just want to clear the air, that people don't come to Montserrat and say, government say. If you're staying in one of those facilities, it is at your expenses. So you have to ask what the prices, what the daily rates are, and agree to pay those fees.
We have Malaika Mackenzie of Aliogana Express also connected virtually. Good afternoon.
Good afternoon. Malaika Mackenzie Weeks for Aliogana Express. My question is, the first question, is the government looking into maybe some type of transportation system to make sure persons go straight from the airport to their homes? Persons are being picked up by people along the way, their families, their friends, whatever. Are we sure that those persons are making it directly to their facility for quarantine? Or do they have the stuff to just stop along the way if they please and if they care? So just looking at some of the loopholes that may happen along the way.
Good afternoon, Malaika, the CMO. So yes, we have identified that as a possible loophole. What we've tried to do is to explain to persons how they can transport their relatives in the meantime. That is a discussion that we would have to have with the government at the cabinet level to see how that can work. Again, the government would not be in a position to take on any further burdens, because who would then pay for that service? So that is something that has to be considered at a much higher level. How that will be implemented and how it will be paid for. So thank you for raising that important point. So sorry, can I just put a plug in there? So just in case people are not aware of how they're supposed to transport their relatives, your incoming passenger, whoever the person is, they're supposed to be transported in the back of the vehicle, ideally with the windows down. Everybody in the vehicle should be wearing a mask. You should not have other passengers there with you. So just the driver and the person that you're picking up. You're not allowed to embrace your incoming relative or friend, etc. No contact whatsoever. So other than then putting in their luggage, you're not supposed to touch their luggage either. In the back, they getting in the back, you drive straight to where they're supposed to be in quarantine, and you drop them off and you leave. And you sanitize the vehicle after the fact. Now, if you need to find out how to sanitize your vehicle, please contact us on the Ministry of Health. The same 2 numbers, 496-4737 and 493-4755. You can also call 491-6059. Sorry, Malaika.
Okay, thank you for that information. How equipped is the healthcare system at this point to deal with serious outbreaks of multiple hospitalizations? I know you say you have a quarantine unit downstairs of Magotson, but how equipped is the hospital to deal with the serious hospitalization of many persons?
Okay, so as I said, we have an isolation unit. We can house up to about 24, so between 20 and 24 beds. And I'm juggling between the bed numbers because, of course, we have staff restrictions, right? So in terms of the nursing staff, but we can house up to between 20 and 24 individuals in that isolation unit. We have about 3 to 4 ventilators that we can use, but we also have CPAP and BiPAP machines, about 10 or so. So we can manage up to about 20 severe individuals. However, ideally, you will need to have one-to-one nursing for your true ICU or high dependency setup. We do not have the nursing numbers to support that, which is why we are pushing for persons to be vaccinated. And I know that another media house would have said about people still being able to contract the virus even though they're fully vaccinated. But I can tell you, and I'll sit here and tell you that the persons who have been fully vaccinated and have contracted COVID-19, they have very mild symptoms, extremely mild symptoms, to the point where when you call them and tell them that they have COVID-19, they are in shock and denial. They can't believe you because they literally we've had asymptomatic individuals, especially the ones who have imported cases, and the other individuals, they itchy throat. I just don't feel myself. That is what they're being reported. So the vaccine is working against preventing severe illness, hospitalizations, and death. We're seeing that worldwide. So yes, it may not be preventing transmission. Okay, fine. Because the overall goal is that we want COVID-19 to enter into the pool of the flu viruses that we battle with every year, right? So just like the common cold, if you have a little sniffle or you have an itchy throat or a sore throat, a little bit of fever or whatever, but you're not sick enough to be admitted to hospital and you don't die, that's great. So that is why we are pushing vaccination. So please, persons, if you have not been vaccinated, please register. Call 491-5218 to register for your vaccine. If you've been fully vaccinated and you need to get your booster, please call the same number and come on and get your booster.
Let me just expand a little bit on, not really expanding, but Malika, congratulations. I haven't seen you since then. It is important. And this is exactly why we are pushing the way we are pushing, because we cannot afford to have large numbers of seriously infected persons. Our health system just cannot carry it. The nurses are few in numbers, and as you just heard, Dr. Green was saying, if you have people in IC units, you need a one-to-one. We cannot afford that luxury. That's a luxury. And whereas other countries do have the staffing number, and even they, at this point, are coming under severe pressure. Just this morning, the United Kingdom is saying 25% of the public service might be off work. And this is the kind of pressure you're talking about in a small community like ours. So that is why we have to mitigate against the threat of COVID and reduce those severe cases so that at least the pressure will not be on the health system, because once it becomes a burden, we're in trouble. And so that's why we're urging you to wear your mask, sanitize, keep your distance, report your symptoms to the, it's absolutely critical. And the opponents might be saying the only thing I'm talking about is vaccine. I will continue to speak to vaccine until I get the population up to 90% of our population vaccinated. I have no reservation in urging Montserratians to go and get vaccinated. We need to get this population vaccinated up to 90% or herd immunity, what you want to call it. I've had my 2 shots, I've had my booster, and if there's a 4th booster, I will go for it. Because there's some countries asking for a 4th booster, in Canada, for instance. I have to protect myself. You need to protect yourself. You need to protect me. I need to protect you. You need to protect your families. This is the only way we're going to be able to suppress COVID. COVID is going to be with us for some time based on the science. It will eventually be like a normal flu. And so the best way out of it is for us to all become vaccinated and take the necessary precautions on a daily basis.
I'll also like to plug right here, Premier. If persons think that we'll be able to medivac someone that requires further assistance and you are positive for COVID-19, forget it. There are no countries, actually, I won't say no. The few countries that are accepting positive COVID-19 patients are very, very far away. There is no way that we will be able to afford to even get a medivac to those far-off countries. So it's not going to happen. MONTSERRAT is the end-all, be-all for a severe COVID-19 positive patient. So please, this is why we are trying to push vaccination. It is primary prevention. All of these other measures that we have out there, the mask wearing, hand sanitizing, all of these other public health measures are secondary measures. Vaccination works. People are going to come back and tell me, oh, you still can contract it, fine, but the persons are having mild symptoms. We are actually very fortunate that the persons who are unvaccinated also have mild symptoms. They're having a little bit more symptoms than the fully vaccinated individuals, but we have to watch them because they can go south very quickly. Thank you.
Okay, thank you very much to members of the press. And as we wrap up, I know that there's still some questions, but bear in mind that the Ministry of Health and the Government Information Unit and all the official sources will provide you with updates as soon as we receive those from the health officials. On that note, I'll have final comments around the table, starting with, CMO, I'm not sure if that was your final comment, but you can definitely come back in if you wish to. So we'll have final comments from CMO, then Minister of Health, closing off with the Premier.
Yes, so just to remind the public, we are now at 8 active cases as of 12 noon today. We have community transmission, more than likely, because we are now seeing active cases that are not linked to any of the previous, imported cases. And just for persons to adhere to the public health measures, so mask wearing or face coverings, hand washing or hand sanitizing, keeping your distance, and please adhere to the mass gathering limit that is now at 15. And also for persons, if you are experiencing symptoms, it doesn't matter if it's as mild as an itchy throat or you don't feel your regular self, please contact us on the numbers that I provided earlier. I'll repeat them now, 496-7437 and 493-4755. And also for persons to continue registering to get your vaccine, whether it is your first shot or the booster. And you can register by calling the St. John's Clinic, 491-5218. The vaccination program will continue. Thank you.
There's not much left after that for me to say, except that on the vaccine end, I want to remind us that from the onset of the vaccine, it has always been said that the vaccine is not a cure, and it does not prevent you from getting the virus. It prevents the seriousness and the hospitalization and at times death. And we have to remember that. And for the underlying people, every little symptom you have and the little blood pressure and the little sugar that you have is not underlying reasons. Go to your doctor, find out whether or not you can in fact take the vaccine. And for parents, I want to put in a plug there now that we have the visor that's from age 12, for parents to look about having their children vaccinated. I know that when you have a young child after 6 months or somewhere, or is it younger?
From the day they're born.
They can be vaccinated, and therefore somebody from 12 up can be vaccinated. So we don't want the resistance in that age group either. So we want to promote that the vaccination is there as a preventative measure, and we must use it if we are going to keep MONTSERRAT going and the economy going. So with that, still have a Happy New Year, and let us commit ourselves to the rules and regulations to contain COVID in MONTSERRAT. Have a good Sunday afternoon, and God bless you all.
Let me thank the media for taking out some time out of their busy Sunday afternoon rest or schedule. And of course, Fiona, you have been working tirelessly over the week. I certainly appreciate that, and Radio MONTSERRAT, of course. Listeners, I'm very, very sorry that we had to curtail whatever activities are left in this season. I truly apologize for it. And I know that you are an understanding population, and you understand why we have to do it. I know that you will not hold it against us, because it is in your interest. And while I would have be happy for you to be celebrating King of Kings tonight and your beach fest and whatever you had. It's truly apologize for us not being able to allow you to do it. But as the minister keep on saying, it's better to be safe than sorry. Let me leave you with this again. This country cannot afford a lockdown, so I'm not going to lock down this country. We will take measures to mitigate and to reduce the number of cases with your help, of course, because it doesn't matter what the Ministry of Health does. It doesn't matter what the government or cabinet does. Unless you're part of the solution, we are not going to be able to win the battle. And the only way we can win this battle, and criticize me if you want, the only way we can win this battle is through all of us being vaccinated. Only reason why you should not be vaccinated is if your doctor says you can't. And so we will continue to provide you with the vaccines and all what is required for us to get vaccinated. We'll provide you with the Pfizer we have. And so persons who did not take AstraZeneca and said they want a Pfizer, I expect to see numbers going up very rapidly because Pfizer is now available. At least 1,170 doses, Doc, I think we got in. That is available for first dose, second and boosters, for second dose and boosters. So they are there. We are working on your behalf. It is your interest. The minister and I could sit back and say, let COVID run. No, we can't do that. You elected us to protect the country and to fight on your behalf. And as Premier, I have the economy, and my government has the economy to struggle with. So apart from the health aspect of it, we have to make sure that we balance it because people have to live. You have to survive. And we have to make sure that the environment is conducive for us to work and enjoy some life. And that is what we intend to do, but we cannot do it without you. So with those words, again, Happy New Year, and God bless all of you.
Keeping Montserrat alive. This is 95.5, 88.3 FM.